The success of surgery is usually dependent on two things. First is safely regaining your motion, while two, protecting your repair. Hence, the importance of restrictions and therapy. Many patients are anxious to begin strengthening, but importantly, this is one of the last steps of the process. This can only begin once you've regained full motion and once your fracture or tendon has healed. There are several types of motion you'll be performing, and you'll move through these as rehab progresses. The first is passive motion. This is where an outside force moves the arm for you, and you relax the arm like a wet noodle. This allows us to regain early motion without pulling on the repair with the muscles inside the arm. Active assist uses a combination of your own power in the injured arm and that of an outside force. And active motion uses only the power of your injured arm. After surgery, you'll attend formal physical therapy about once or twice a week, and this usually starts within 2 weeks of your surgery. The therapist will be your coach. They'll train you on the exercises I prescribe, your restrictions, and help you set goals. They'll teach you proper technique, and most importantly, your home exercise program. Like in school, the real gains are made at home on your own. And like a school teacher, they cannot do your homework for you. Remember, therapy is a place you go, not a thing you do. Your home exercise program should be done 3 times a day. You'll do 3 reps of each exercise with 15 seconds holds 3 times daily.